So one of the biggest players that we really haven't talked about in healthcare is hospitals and hospital systems. We see day in and day out more and more consolidation of healthcare systems. In my world, Duke is buying up everything, UNC is buying up everything, and then the Sanger Clinic in Charlotte is buying up everything, so you have fewer choices. But this is a big deal as we begin this disruption and this innovation in healthcare. What does it mean to hospital systems and healthcare systems, and how might it impact them? What are the pros, what are the cons? I'll toss that to you, Colin.
Oh man. So I think one of the pros of all this innovation is it's going to make them more efficient. I think as all these innovations come out, as all of the disruption happens around the supply chain, around clinical practice, it's going to make these larger entities more efficient, which is what they really went and did all this M&A work for. So I think, their big challenge over the next little bit is actually not so much in their size, but more around the culture and changing the culture so that they can adopt to these changes much more quickly. Because right now I think they're kind of ill-equipped for that. They're not really equipped to absorb these changes that are going to happen. They're not really equipped to absorb all the different practices that they've actually acquired over the last little while. So I think there needs to be a change that happens around that.
I'd like to add on to that. I think one of the biggest problems health systems have is that they've just got a partner. They have such small margins. They're barely keeping doors open at this point. And now with the shift to, outpatient, everything being outpatient, they're so afraid of filling their beds. I think it's about partnering with a disruptor, partnering with an Apple, a Google, a startup. The appetite for failure, the appetite to realizing sort of where they fit into disruption and innovation. I think there has to just be a fundamental identity crisis that needs to happen to say, look, this is just not who we are, but we play such an important role. Come to us, our doctors will be the end user, the stakeholder, our patients will be in the pilot, and we'll partner with you.
My concern when you talk about big healthcare systems, and I've watched it happen throughout my career, is we have gone from a healthcare system that includes the voices of doctors, how we run the hospital, how we run the operating room, how we run the cath lab, that now we have been eliminated from that decision-making process. We are nothing more than employees. We are just there to perform a service with no say-so, and all the expenditure at the healthcare system is now on this middle-level administration. And I'm concerned that these middle-level administrators do not have the insight and the understanding to embrace these type of technologic innovations and changes.
Let me build on what Geeta's talking about, because from an economic view for communities, we have to think about the ecosystem of a community. Hospitals are the economic engines in their local markets. They're big employers. It's why in the US and probably in Canada as well, particularly in Canada, it's very hard to close beds because they employ people. Every bed spawns off a few more jobs, and then that hospital spawns jobs in the local community, the florist, the coffee provider, etc. What's exciting though, and I just read an article on how telehealth is now challenging the real estate model of the hospital because more care is going out. But we can look at folks like Mercy Virtual in Missouri, Intermountain, and UPMC. They all have plans to build, quote, virtual hospitals, which are going to be the brainchild, which will then provide advice out to the hinterlands, to rural areas, and even maybe cross-state if people have licenses. The opportunity for physicians and hospitals at the same time is you all have to reinvent yourselves. The hospital needs to think about, what are we without beds? What is our role? I'll tell you what you are. You are a key community player. You know your community. You know the people. You, love the people in your community. There's humanity in the hospital. Again, very trusted. Who's the most trusted employee in America? The nurse, the pharmacist, the doctor. Harris Poll, every year for 10 years. Except the last year pharmacists fell because of opioids. That's a whole other discussion. And our firefighters are up. In any case, it's about reinventing the role of the physician. Physicians are now digital experts, or going to be.
If they're not, they're behind the tide.
Well, they have to become the digital health coach, and the hospitals have to be the center of those social determinants of health, right? Come here. Let me talk about Geisinger. I know I don't want to hog the spotlight, but one innovator, Geisinger in the center of my state of Pennsylvania, doing genotyping on babies, newborns. They've had their 10-year-old precision medicine project. Eric Topol now says Geisinger is the place to look at for genetic and precision medicine. But what else is Geisinger doing? The food pharmacy for people with type 2 diabetes, to get people eating right, shopping right, reading labels. Geisinger's got it, womb to tomb and everything in between. They will be relevant to that center swath of the state of Pennsylvania. And other hospitals have to reimagine, who are we for this market? So I will leave it there.
Jane, I think that's brilliant. The only other thing I'd add to that is, again, the fear of failure. There has to be an appetite for failure. To Kevin's point, right? That middle management, there's some SVP, EVP that is terrified of taking a chance, and there has to be an appetite that...
For them, the status quo is okay. Their metrics are just keep the boat afloat.